Ballad Hospital, surgeons stopped doing elective surgeries last fall.
Yeah, that revelation confirmed tonight. Ballad says the loss of service in Norton, Virginia at Mountain View Regional Hospital came after surgeons voiced concerns about the safety of patients.
Chantel Batista found out some question the way in which Ballad communicated to the public.
Mountain View Hospital in Norton, Virginia. Until last October, patients could have elective surgeries here. But that changed when doctors told Ballad Health management that wasn't the safest way to provide patient care.
That was putting a lot of pressure for them to cover both places, at the same time for our physicians to cover in both places full time and provide the care they felt like was appropriate.
Ballad says patients now can get elective surgeries at 2 other hospitals in Wise County.
With plans of the state.
Wednesday afternoon, a Ballad Health executive went before the Southwest Virginia Hospital Authority Board, the group charged with overseeing the cooperative agreement that allowed the merger, which created Ballad Health. Ballad said it notified the Virginia Department of Health about the change at Mountain View Regional last fall.
Between us and Ballad, I think that the communication has been pretty good. It's gotten certainly better over time.
But some on the hospital authority board said they didn't know about the change until reading about it in a news report.
And I think the problem, Mr. Chairman, was communication.
Among those critical of Ballad's handling of the change, delegates Todd, Pillion, and Terry Kilgore.
The communication's key in making this merger successful, and so far they're failing at communicating effectively. I think we all should be involved. I think we shouldn't be getting, the authorities shouldn't be getting information secondhand.
While Ballad Health CEO Levine was not at the meeting, he was talking about it on Twitter, saying tonight, "We will never be perfect. But what's also true is no rural hospitals have been closed since the merger, and we are reopening one." Despite questions about communication, a hospital authority staff member praised Ballad's interaction so far.
One of the things that has impressed me as we've had additional meetings, additional contacts, is the depth and breadth of the quality of the management there.
Tonight, Ballad Health called claims that it did not properly notify about the change incorrect. And Ballad said a key reason for the change was lower patient volumes, a drop in the number of patients coming to rural hospitals for care. That's something that's impacting hospitals across the country. Sarah?